Hello everyone! Today we will be talking about telemedicine and virtual visits at the NYU Dysautonomia Center for patients with familial dysautonomia. The NYU Dysautonomia Center has been serving patients with FT since 1970, and it remains one of the preeminent international facilities for treatment of this devastating and progressive disease. Our center devotes itself to the care of patients with this complex disorder to provide each patient with a comprehensive and individual plan of care. Our center sees patients from all over the country and the world for their annual and interim visits. FD patients have regular in-person visits with the specialized care team, including a family nurse practitioner, a neurologist, pulmonologist, gastroenterologist, and ophthalmologist. And as you can see here, patients fly in from all over the country and the world to receive care at our center. Regular annual in-person visits are encouraged for every patient to receive the latest up-to-date level of care. While beneficial for overall health outcomes, this care model can be financially burdensome and time-consuming and can create a barrier for patients who need to travel significant distances to reach a specialized FT center. Prior to the pandemic, out-of-state and even some in-state patients complained that visits into Manhattan were financially burdensome, time-consuming, and put patients at risk of complications due to the special considerations and accommodations needed for travel. Frequent in-person appointments can also increase the risk of infection and even greater concern in light of the ongoing COVID-19 pandemic. When the COVID-19 sheltering-in-place order came into New York City, we had to reimagine what a visit to the Dysautonomia Center looked like. We wanted to remain accessible and give our patients the best quality of care possible from the safety of their homes. So the Dysautonomia Center had to ask ourselves, how would this look like for medically complex patients? Telehealth offered care options for patients with FD that overcame many inconveniences and safety concerns surrounding in-person appointments. However, the level of monitoring required for a routine FD patient visit went beyond what a normal telehealth visit could provide. As the pandemic had forced many clinics to transition to telehealth models, the FD Center developed a special task force to advocate for patients to continue to receive comprehensive care. In response to the COVID-19 safety measures, the Dysautonomia Center, with the help of the FD Foundation, implemented a telehealth model that involved web-based video appointments with multiple members of a multidisciplinary team and kits with written instructions and videos demonstrations sent to patients prior to the appointments. These kits are used to measure weight and height, evaluate lung health, listen to heart sounds, record EKGs, assess gaits, and look for ulcers under the supervision of a healthcare provider. Here's a video that talks about all the details of our kit.
Welcome to the FD Kit. In here, you will find everything necessary in order to complete your visit.
Hello, welcome to your telemedicine visit with the Dysautonomia Center. Using telemedicine is new to many people, and like anything new, it can cause some initial anxiety. We understand this, and so have prepared a video to help you through this journey. Please take care of all of the items inside the kit and return them in the same condition that you found them in, because these are tools that are vital for the continued assessment of others, and your actions in caring for them are caring and respectful actions towards people who need to use them after you.
Each kit included a real-time electronic stethoscope, which allowed patients to transmit heart and lung sounds to our licensed care providers, a cardiac EKG monitor to capture medical-grade EKGs in 30 seconds to detect for atrial fibrillation, bradycardia, tachycardia, or normal sinus rhythm, an on-run blood pressure machine to monitor orthostatic blood pressures and symptoms from the comfort of their homes with an ambulatory, clinically validated machine, a 24-hour blood pressure monitor to assess blood pressure variability throughout the day, a pulse oximeter to monitor heart rate and blood oxygenation status, an Apple iPad which conveniently was able to send all files to providers in real time, and return shipping labels to decrease turnaround time and to gather all the data in a timely fashion. Many patients expressed great feedback regarding the virtual visits. Here are some examples of the great feedback we received regarding the kits. Patients and family members expressed how the virtual visits remained comprehensive, thorough, convenient, and extremely helpful during such uncertain times. While the world was on pause, patients with FD continued to need high levels of care and attention to ensure their health did not deteriorate or regress. Among the benefits of telehealth, we identified were the lack of travel time to the clinic, lesser time away from work, and reduced risk of infection. Some limitations of the telehealth visits included lack of access to Wi-Fi and limited physical examination. Over the past year, patients and families have expressed an overwhelming support for telehealth. This encourages patients and providers at our center to incorporate telehealth clinics into FD care beyond the COVID-19 pandemic. Future work will need to be done to assess the effects of telehealth visits on FD health outcomes. As always, in-person visits are opened and encouraged for patients and their families to continue care for patients with FD. This model is just one example of many of how the Dysautonomia Center puts patient safety at the forefront of patient care. We will continue to adapt with the times and ensure that every patient, regardless of their geographic status, is cared for and receives the latest information to live the best possible lives they can. Thank you very much for your time.